name's Frey. I'm from Orlando.
Okay.
I'm 32 years old.
Okay. When did you start losing your hair?
Around when I was in my 20s.
Okay.
Around 22.
Okay. And you say you're 32 now?
Yeah.
Okay. Who has a hair loss in your family?
I think it's from my mom's side.
Okay.
My dad's side, it's pretty hairy.
Okay. And how does hair loss affect you? How does it affect you personally, or?
Well, it makes me feel kind of old right now. I want to look a little younger, or my age. And sometimes it's kind of hard to, do my hair and look normal.
Okay. Okay. And what are you hoping to accomplish today?
Well, I'm hoping to have probably my hairline back and more density in the front.
Of course. Okay, excellent. I'm going to pan up just a little bit to kind of show you. We're going to put some pictures on there too. But you can see he has some recessions on both sides. He still has that central tuft in the middle and has hair in centrally, and he's losing a little bit of hair in his crown region too. Although he still has quite a lot of hair there to save. We're going to be talking about preventative products with him in just a bit. So anyway, looking forward, and thank you for letting people see your day and how your experience is. I'm sure that someone or many people will relate to you as far as your pattern of loss and who you are. So thanks again.
Thank you.
Dr. Hubner here, Natural Transplants. I'm here with the VIP patient of the day, Frey. And we're about a third of the way through the procedure. At this point, Frey has had the anesthesia all the way around the head. The strip has been removed and it's been sutured up in the back. And I wanted to ask you, Frey, how has the day been going? Tell people about your experience.
Very, very easy. Minimal pain, just the anesthesia. But after that, everything is smooth and easy.
Yeah, we're watching some Top Gear, talking about cars. I mean, it's a very enjoyable day. I know, all the videos I keep saying that, but it truly is not a bad deal at all. He had a vision of, he watched a John Wayne movie, and they were talking about scalping. The American Indians were doing all this scalping of people, and he got this idea in his head that it was going to be some barbaric procedure, and it was going to be blood everywhere, and it really is not that way. So I'm very excited. I'm going to turn you around here, Frey, and show people what it looks like. So now Frey allowed us to shave his head, just so you know. So he had a lot of hair still in the central portion here and in the crown, but you can see from the back that it's not an issue. He's going to be able to wear a hat, keep his sideburns, and no one's going to know the difference until it grows back. Once it starts growing back, in about 10 days he'll be able to shave everything down to make it all match a little bit better, so it doesn't look like this. But as you can see from the back, here's the suture line. Come around this way here. So again, just a thin line. You can see how it's perfectly approximated all the way up. That's going to be the width of his suture line. Just a look. If you took a pen and drew a line, that's the width of the suture line. So there's very little tension on this suture line all the way around. Now Frey has a larger head, which yielded us a lot more hair for him. So we got 37 centimeter strip. That's crazy. That's got to be one of the records for me. So as far as how much hair we harvested, so really excited. You can see how his natural hair just comes right over that. This suture line's never going to be an issue for Frey. He's never going to have an issue where he has to have his hair a certain length for the suture line. So he's probably going to wear his hair longer because he's going to have the hair. So, that's really exciting to think about. So in any case, you can see where we've driven his hairline. Again, as I said in all the videos, this little line here is from the anesthesia. That's a little bruise that will go away in about 3 to 4 days. This is going to be his new hairline. There's going to be 1 and 2 hair grafts staggered up and down on this line, so we never do a straight hairline. We always go up and down staggered on the line. It's drawn straight just for my eye because that's the only way I can draw it. We're going to really focus on this frontal third, but then we're going to have enough hair we're probably going to get back into his crown, and that's why I shaved off this little area here. So hopefully we can get back into here. His donor strip looks amazing, and I'm very, very excited. I can't wait to see his results. Thanks again, Frey, and we'll be checking back on you when we're completed the surgery. And thanks. Dr. Hubner here. I'm here with our patient of the day, and I'm very grateful that he's allowed us to track his progress throughout the day. So now we're finally done. It's been about 5 hours in total from beginning to end. And right now, how are you feeling?
Good.
Yeah. Any pain right now?
No,
Yeah.
just pressure, but it's okay.
Yeah. So the anesthesia will wear off in the next hour or two, and then he has some pain medicine available to him. He can also take ibuprofen, Aleve, Advil, just nothing with aspirin. I want you to kind of zoom in here. You can see what we did. So you can see how jam-packed this frontal area is. You can see where his new hairline is going to be, nice and jagged and staggered everywhere. Little tiny grafts in the front. These bigger grafts behind here are going to have anywhere from 4 to 7 hairs depending on where they are. So that's going to be a nice transition into those larger grafts. This is going to yield him about 30 to 40% of the density that he has in his donor over this huge area here. He had some hair here in the crown and he was nice enough to let us shave, but this is just going to add to what we already have. No more recession. He's going to look much younger and look his stated age. So very excited about that. His incision in the back came together seamlessly. He's not going to have any issues at all with that. So I'm very excited to see that. And thank you so much. Anything you would say to people that are on the fence about a hair transplant, or if they're scared about the scalping and all this?
Yeah, it's easy. It's a fast procedure. I'll say, because of all the stuff that involves, but it's quick and it's painless. Just a little bit things here and there, but it's not how maybe people look at it. It's really easy, and I really appreciate all you guys being super nice and make me very comfortable with you guys.
You're a great patient, and I wish we have all our patients are just a great patients and very nice people as well. So looking forward, we're gonna follow up with this guy obviously, and in 6 months you're gonna really see a dramatic change. Nothing's gonna grow for 3 to 4 months. Looking forward to your results. Thank you so much.
Thank you.